Welcome to Semester 2 of Nursing School, specifically MedSurg. This video is based on proper medication administration and will hopefully help you on your next simulation. Step 1. Preparation. A couple days before your scheduled medication administration simulation, take 30 minutes to sit down and review your patients through SimChart. Here you will find physician orders. Pay close attention to which medications are to be given and what route is used. Use your drug book to find the classifications, uses, important nursing considerations you must know before administering the medication, such as vital signs, lab values, allergies, etc., what to assess and evaluate when giving the medication, when you should hold the medication, and the rate of the administration for IV medications. Remember, if it's an IV push medication, the second flush needs to be pushed at the same rate as the medication itself. You are allowed to bring your notes into the simulation, so make sure to use this time to prepare. Step 2. The simulation. On the morning of the sim, make sure to come in full clinical dress. Also, be sure to know your Evolve username and password. This is a timed simulation. Enter the room and instantly log onto SimChart. Compare the current physician orders with your notes. Some medications may have been discharged, the patient may be unable to take certain medications due to allergies or diet restrictions, and lab values will now be in the system. This is a perfect time to get vital signs. Check blood pressure, pulse, and respirations. A little tip, sometimes it is hard to palpate the radial pulse on these mannequins. If you are unsure of your assessment, auscultate over the radial pulse to get a definite answer. Review the new orders, lab results, and newly acquired vital signs to determine which medications you need to administer, and in some cases, which medications you need to hold. Step 3. The meds. Now that you have updated orders, lab results, and vital signs, go get the medication you will be administering. If you are giving an IV piggyback, you can set it up before you call in a professor to watch you. Step 4. The checkoff. Once you're ready, call a professor to come watch you administer the medication. 1. Perform hand hygiene before entering the room. 2. Introduce yourself. 3. Ask the patient for their name and date of birth. Make sure it matches their wristband. 4. Ask about any allergies your patient might have. 5. Tell the patient what medications you are giving and why. This is where your professor will ask you questions. What is the classification of the medication? What is it used for? Make sure to know why you are giving the medication. What lab values you need to know before giving. What are the side effects? What do you need to monitor? 6. Put gloves on before administering anything. Always be safe. 7. If you are giving an IV medication, be sure to clean the IV port with an alcohol swab before connecting the tubing or the flush. 8. Celebrate, because you're a smart nursing student and you just passed your medication administration.